Okay, good afternoon, everybody. My name's Steve Herron. I'm the president of Brand Point Services, checking in today from the suburbs of Philadelphia, Pennsylvania. And we are going to give it just another minute or so as it takes a little bit of time for folks to get logged on. You will notice when you're logging on that we have controlled your microphones, so your microphones will be off and your cameras will be off. That'll give us maximum bandwidth and make it, more easy for you to focus on the panelists. So we're just going to give it another minute as people are logging on, and then we will get this show on the road. You will be able to submit your questions for this discussion, and please don't be shy, in the Q&A panel of the Q&A box. If you go down to the bottom of your screen, you should see a Q&A box where you can submit questions, and we will do our best to answer all the questions that you submit. So we're just going to give it another minute while people log on, and we'll get underway. All right, so let's get this show on the road. Again, your mics will be muted, your cameras will be off for those of you joining and listening in, but we will ask all our panelists to go ahead and come off of mute. And I'm going to start by introducing our panelists today. I'm going to go around and introduce each panelist. Then I'll circle back around to each panelist and have them make an opening statement to address the original question that we posed as the premise of this webinar, which is essentially, as essential businesses that haven't had to shut down, what are the challenges you've been facing? What are the lessons you've learned? So we'll hear from each panelist with an opening statement, and then we will open it up for Q&A and discussion. So I'm going to start by introducing the panelists. Again, for those of you logging off late, my name's Steve Herron. I'm the president of Brand Point Services. We are a national general contractor and facility maintenance provider. And we are very fortunate to be joined by this group of panelists who are taking the time out of their day to share their thoughts and input at a really, really interesting time for all of us. So I will start by introducing Monica Munoz. Monica is joining us today from Dallas, Texas. She's the portfolio director for DaVita Kidney Care. She probably won't admit it, but she's got a couple decades in this business. So she's experienced is the word we will use. And she started very, very young, I know. Monica has been with companies like Zales, Jones Lang LaSalle. She's actually, as part of her career, worked for Prism before it was Connex. And most recently, of course, DaVita Kidney Care. What you may not know about Monica, or what others may not know that I happen to know, is she's quite accomplished and talented singer. So if you stick around afterward, she might perform. Is there a chance of that, Monica?
I don't know about that, but we'll try.
that's called a total ambush.
Yep.
All right. So welcome, Monica.
Thank you.
Next, we have Todd Frank from Walmart, senior architect. Again, a couple of decades in the business. Todd's checking in today from Bentonville, Arkansas. He's been in the architectural design for the retail industry, health and wellness, hospitality, automotive, fuel, tenant development, grocery, design. Todd's done quite a bit in his career. And one of my favorite things about Todd, aside from the fact that he's an avid jet skier, is he's an Eagles fan, stuck in the middle of the country. And so most of us Eagles fans can be found on the coast, especially the East Coast. And Todd, you got a prediction for the draft today?
Oh, I have not even been paying attention. So I just
Well,
hope they get someone that starts.
all right, there you go. Last I talked to you, you were still mad at Alshon Jeffrey for dropping a pass in the playoffs 2 years ago.
Yeah.
So welcome, Todd. Thanks for joining us. Then I have Fred Leone from Coffee and Bagel Brands, also checking in from Dallas, Texas. Fred's the director of facilities, and he has been for 4 years for Coffee and Bagel Brands. Been in that business for 15 years, retail and restaurant primarily. Fred's interests revolve around his family time and deep sea fishing. When's the next time you're going to get a chance to catch a fish, Fred?
Good Lord, who knows? Especially in the sea.
So hopefully sooner than later, my friend. Thank you
Yes.
for joining us.
Thank you.
And finally, from metropolitan New York, from Long Island, a little place called Point Lookout, Andres Matos of TD Bank. Andres is a regional facility manager for TD Bank, has been with TD for 18 years. My favorite thing about Andres is he's an avid Ayn Rand follower, much like myself. This is just for you. This is just for you, Andres. Everyone should have this great lady's one of her books on your shelf. First time I sat down to have dinner with Andres at a Prism Now Connects function, I claimed to be an Ayn Rand follower, and he challenged me and he said, what's the opening line to The Fountainhead? I said, Howard Rourke laughed. We've been best buds ever since. Welcome, Andres. Thanks for joining us.
Likewise, thanks for inviting me.
So what I'd like to do now is go around the panel and have each panelist take a minute or two and just address, the premise of why we all got together here today and talk about what you've been going through this past 6 weeks. So I'll circle all the way back around to you, Monica, if you don't mind starting, please.
Sure. So thanks for having me again. The interesting part about our business, so we are a dialysis services company that provides dialysis treatments for people whose kidneys have failed. So we knew that we had to prepare for treating COVID positive patients. So our preparation wasn't about closing, but about how do we prepare to allow vendors, to allow teammates, and prepare for what we knew was coming. Our first thing was to restrict access to non-essential work, then move work that normally it takes place during hours to after hours. Then we issued specific guidance, written guidance to the clinics as to what the expectations were, how to allow people in, how to allow teammates in and vendors. And then we instituted specific protocol of temperature testing, question and answers of assessing if they were safe to come in, and wearing masks during all the work, while doing all the work, and while in the clinics. And part of our consideration was contamination both ways. So we didn't want to bring in and contaminate to the people or patients or teammates. So it was both ways for vendors, protecting the patients and protecting the vendors and teammates.
Very good. One point of clarification, restrict access of non-essential work. Is that what I think I heard you say?
Yes, so non-essential work would have been our projects that we had under construction. The majority stopped. Mm-hmm. Some of them were able to continue if we had to for specific reasons, but the majority of our non-essential, non-critical work has stopped.
Okay.
Preventive maintenance and emergency repairs have continued.
Got it. All right, thanks, Monica. All right, let's circle around to Todd. Why don't you go next?
Okay, very good. Well, as you know, we haven't closed down any of our stores. The U.S. government has deemed us as essential. That's out there. But within our stores, we have closed down vision centers. We have closed down tenant spaces as well, banks, anything that's considered non-essential that's there. We have closed all those down. We have developed, we're very concerned about the 6-foot social distancing. So we have put lines in front of our store to start to segregate people to be 6 feet apart. We also, a couple of weeks ago, decided that only 20% of our occupancy would be allowed inside the store. So normally our stores could hold up to 5,000 people, but right now it's just 1,000. Now, that's not as big of a deal as what people may think, because we have about 1,000 parking spaces across the all our stores that are out there. So if one person comes up and comes into it, you could have 1,000 single persons that are right there. I think what we're finding is we're seeing a nice fluctuation of people coming in, flow of people coming in under 1,000. I think for the most part, we're not seeing any, really long lines. I know there's a few stores where we've seen that. Valley Stream comes to mind, where that store just does an incredible business. We have put up plexiglass shields at the cash registers in the pharmacy. We're working on putting it into the vision centers when we open those back up. Our pharmacies are open right now. Obviously, that's very important. The other thing we did in the pharmacy was we adjusted the airflow to provide a little bit more negative pressure. The problem that we ran into was we put the plexiglass in the front and we added more negative pressure. And if the HVAC unit was not working properly, it either got too cold or too hot, which triggered a service call. In the end, that was probably a good thing. So we got some things fixed because of it that needed to be fixed. Our associates now are wearing masks inside the stores. Eventually when I go back to work, that'll probably be the case, and we'll probably have some social distancing rules going on. State of Arkansas is opening up probably May 1st, somewhere in there. But obviously we've got stores across the nation, and so we're into that. We're also, we're considering, and I think this will be a done deal here next week, that all aisles will be single file aisles. So you can only go down one way, and they're trying to do with that. We're open to a lot of suggestions. Some of y'all may have read that we have at least 10 COVID-19 testing out in the parking lot for the healthcare workers that are out there, and trying to do more. It's a tough thing to do. So that's kind of been our program that's out there. We did stop our construction program for anything that had not started back in end of March. And then we continue to finish out those projects that are out there. However, right now we're looking to restart June 1st. And I will tell you, as from a contractor standpoint, Steve or Andreas, Fred, and Monica, you've got all these other vendors that support you, and they've got to adjust. And it's real important that we keep them informed over what we're about ready to do.
Very good. June 1st restart. I think at this point, we'd all take that better than we don't know or no idea or end of the year or all the other scenarios that have been played with. I think we'd all take it.
And that's just, right now, that is just a point in time. It could change. I hope it doesn't. In Arkansas, we're seeing a lot different results than what you're seeing in Pennsylvania or New York. But Oklahoma's seeing a lot different results as well. And some of y'all may have even saw where building departments, some of them shut down. And but the other thing that I did hear about today was they were a lot of the building departments that are out there were doing a digital over-the-counter review, and it was going faster than if they were marking up paper. So I don't know if they're just not that good, or boy, they really know their stuff.
All right, thanks for those thoughts, Todd. Let's keep rolling through the panel and move on to the world of coffee and bagels. Fred, what are you seeing out there in the edible category?
Yeah. Well, with the fast casual restaurant, we've been affected, obviously. Catering has suffered immensely. We've had to shut down temporarily a few stores that we plan on opening back up. We have taken, several hits, but luckily we do have drive-throughs, we do have curbside pickups, and we do have a contract with DoorDash. So that's helped out quite a bit. But like everyone on the panel here, we've taken measures to make sure our employees and our customers are protected in any way we can right now, with sanitization, with increased reps of thorough cleaning, and then with sending our bakeries these sanitization kits that we have come up with our partners. But as everyone knows, we're going to continue changing. I think Todd alluded to this. We just don't know. There'll be changes coming up. There'll be rules, regulations, codes, all revised. So we just have to keep up with what's going to be hitting us, and be prepared as best we can. But for now, like everyone else, we've increased the PPE equipment to all our sites. We've taken precautions on sanitation, like I said, sanitizing everything, the surfaces, keeping our employees on a thin, it's a thin crew. With we don't have full crews in there just because of the distancing regulations. But aside from that, that's all we're doing. We're kind of keeping up with what we can. What you hear, using the CDC website for any suggestions and anything that can help us get through this and be more prepared for what's coming up, because we did reduce certain services. We've reduced our trash pickup. We did reduce our capital expenditures with any projects that weren't started as of March 31st. And just trying to reduce any risk that we have out there right now with any possible contamination, and just hoping that Todd's good with that June 1st, because I'd be thrilled to death with that.
Fred, it's really interesting that you mentioned the trash pickup. One of my best friends since I've junior high is senior vice president for McNeilus Corporation, and that's what he does. He sells garbage trucks.
Right.
And he's been there 25 years and was furloughed. And I said to him last night, Chris, I don't understand. Trash is trash. Humans consume. He said, no, you have no idea. So trash is down with commercial 70%, and that's who generates most of the trash.
Right.
You're validating that, right? That reduced trash pickup was one of your bullets.
Yeah, our dining rooms being closed, that produces probably 70 to 80% of the trash at each of our bakeries. So yeah, we naturally dialed it down on the trash pickups and recycling.
You would think garbage removal would be the most recession-proof or crisis-proof thing out there, and it turns out nothing is safe. You also mentioned, catering, just the fact that I'm not working in my Brand Point office with 20, 30, 50, however many people that maybe twice a week or even once a week would be ordering bagels in for everybody, right? All that's gone.
Yep.
The drive-through and curbside, I assume, picks up, but it can't make up for that. You mentioned sanitization kits. What's in a sanitization kit?
We've had our janitorial partners put together, again, with the CDC regulations, these little kits that come in a kind of a bucket for each site. And it tells them how often, how repetitive to clean any surface. And they're being cleaned depending on how many people walk into our bakeries. As many as 15 times every half hour.
Wow.
Just depending on what gets touched. But yeah, they're just basic little kits that get replenished when they need them, and they're using them on a daily basis.
All right. All right. So we've heard from healthcare. We've heard from pure grocery retail. We've heard from fast serve food. What's going on in the banking industry, Andres?
What's going on? What is not going on is the question.
Yep.
I can tell you that as an essential business, the impact to us was multifaceted. We obviously had to deal with the external customer. We had to harden our corporate infrastructure to support the retail world and the customer. We had to really rethink the entire store operating model on the hours that we open, how we service the customer, continue to adhere to a social distance and a safety standard, which drove into us rescheduling how we do our PM type of services with our vendors that are critical, like HVAC. We have a lot of bank equipment that, because of the model that we adopted, is now taking more usage than normal. That's our drive-through. We are operating primarily right now as a drive-through operation in our stores with limited hours. And from a cleaning perspective, that took top priority, something that I'm not going to say in BAU world it was not, but it took even a more heightened priority. There was a higher demand on our providers of those services, both from our constant changing and enhancing of those services, almost on a weekly basis, if not more frequently. We kept learning more as we went along, and it seemed like every 4 or 5 days we were reshuffling the deck from a janitorial point of view and asking our service provider to adapt to it. And I'm glad to say that the majority of them have done a great job in that support. And then there was what I call behavioral modification of both our employee and our customer. And those are protocols that we put in place really on the run. The concept of just drive-through banking, just to give a funny example, how you think of everything, but you don't. So we figure, okay, we'll close the front doors and we'll do transactions at the drive-through. Well, guess what? We didn't expect 200 people to walk up. So now we have a confluence of vehicle traffic and pedestrian traffic. And all of a sudden we're dispatching 1,000 orange cones that we were able to gather in like 24 hours and deploy to all of these stores from Florida to Maine to separate the traffic. So you kind of make do with what you got, and you become very reactive quickly and develop solutions.
So am I understanding you correctly that people are walking through the drive-through?
Exactly.
Okay.
So we now have walk-up lanes, and they've been designated as such, and they're clearly marked. So we had to roll all that out really quickly.
That's really interesting.
Hey, Andreas, in California, McDonald's had a lawsuit filed against them for a person walking up after hours. They couldn't go inside, so they walked up and they actually won the case, which, you know, I just think it's kind of crazy, but.
That is crazy. We do still in Manhattan, where we don't have a a drive-through. None of our stores in most urban centers like Boston, Philadelphia, New York, those stores are operating strictly on a ATM type of service at the ATM machine at those vestibules. And we have what we classified as hub sites that are open to the public inside of the store, but those are limited hours. There's a traffic flow that is monitored, the number of people that can come in and all of that. But again, I think overall the financial, at least the retail banking world has adapted relatively well, given the circumstances that were thrown on us.
All right. All right, so we've now heard from each panelist with their opening thoughts. We've got 20 minutes left, so would love to open up for some Q&A here. So I've got some questions coming into the chat. I'm going to start with those, and then I've got some questions of my own as well. So let's start with Michael Horning asked a great question. I assume this is geared to Monica. Are dialysis patients considered at higher risk to COVID-19?
Yes, unfortunately, dialysis patients have some form of compromised immune systems and or other issues, health issues. So yes, they would be considered more, sorry, can't think of the word.
Susceptible.
Susceptible, thank you. But just to add a few things that Fred made me think of, we did add, once we established which clinics were going to add shifts, so we, to treat the positive patients, we increased the air exchanges so that we could clean the air hopefully faster than we would normally. So that was one of the changes. The other one was our infection control protocols were already sufficient for this particular virus. So we were more concerned about extra cleaning from after construction or repairs. That was one. So we instituted that to the vendors that are going into the clinics. Certainly with the janitorial companies, we also had to work with them to make sure they brought PPE with them, the gloves, the masks and coats, and properly dispose of trash and super extra clean as well overnight. And then we added shifts to other clinics so that we could parcel out and treat patients that are positive separate from the normal population.
And Monica, along those lines, you're doing COVID testing as well at DaVita, correct?
We do COVID testing for teammates and patients. It's not open to anybody that wants to come out to test. It's just it's a quicker nasal swab testing that can give us an idea of what we're dealing with so that we can properly redirect that patient if we need to.
Okay. So two things I'm hearing from all the panelists, it seems, is that intensified cleaning across the board and air exchange, which was one I hadn't been thinking of from an HVAC standpoint. Do you think those two changes are permanent? I'll just ask the panel, is there going to be a day where we go, oh, we're not going to do that anymore, or is that just the temporary?
I think you got to evaluate that. That was one of the things. I talked to several mechanical engineers before we tried to pull the trigger on that. I had some that said it really wasn't going to make much of a difference, and they showed me their calculations. I had others said differently. So you are kind of limited by ASHRAE over the amount of outside air that you can bring in. And so I think that's another part of that right there. Maybe, the one thing I did hear that all the mechanical engineers recommended was those ion air filters that, that suck in so much air. And, they said, hey, why don't you put 2 of those? Well, we sell those, and some of the stores are doing that too as well. That's out there.
Okay.
Our plan wasn't to be permanent, at least not for now. We're only did it in clinics that are treating positive patients. We did not change it in the rest.
Andres, Fred, do you have a comment on this one?
Yeah, we've had some mechanical engineer, actually some of our service, the providers recommend ultraviolet light in our system, our mechanical system, to deal with germs and the contaminants. I think the janitorial industry will probably go through a major change. I think you're going to see in the future a focus more on disinfectant, sanitation, sanitizing of surfaces more. I think you may even see an increase in frequency of cleaning. I think the customer is going to ask for it, if not the employee. So I think there's too early to tell what that's going to look like, but my guts and instinct tells me that you're going to see some changes coming out of that.
Fred?
Yeah, I agree. I'm not sure this will all be permanent, like you alluded to earlier. Again, positive thinking that someone comes up with a vaccine for this, and it's a moot point, and it's just like any other flu. But yeah, until then, I just think there's going to be some increased visibility of this, the sanitization of everything, cleanliness, and the air we breathe. So things could happen quickly, things could take a while, but I think inevitably this pandemic will have an effect on how we operate in the future.
All right, from Asan has a good question here. What are some main store or building modifications? And Asan's, hang on a second, it keeps moving on me. All right, what are some main store building modifications your companies will have to do to mitigate any cross-contamination? Are state and local officials mandating these changes, or are they initiatives that you are proactively doing? This is Asan with Choice Hotels.
I can tell you, I think it's early. I'm not aware of any that are state mandated. I don't think people, they may have thought of it, but I don't think that I'm aware of anything has come out that is official. But I think, as Fred said, and Todd and Monica before, it's going to come out eventually at some point. Some recommendations, some guidelines that are going to come out of these municipalities.
Any other panelists comment on that one?
Just say that the social distancing, we're putting a lot of stickers, trying to line customers up. It's not really a building modification, but it is a change to the traffic flow within the building. So, will that make a difference? I certainly hope so.
Yeah, I think building modifications at this point are a little premature until we're all locked into what what the new regulations will be and what the requirements will be. So anything modifying the building, I think it's a little too early to start on that until we have what the specifications are or will be.
All right, I've got a question for Todd. Todd, someone's asking if you can elaborate on the McDonald's lawsuit you referenced.
Yeah, what I remember about it, and this was a few years ago when the McDonald's folks were down in our building, and they had a handicapped person that it was after hours, and they wanted to get something. Now, it was purposely done, especially it was in California. So it was purposely done, and they walked around the building to place an order, and they weren't served, which, you play a huge role between protecting the customer and vehicular traffic. And, I just, these are things that really kind of bother me out there when they do something in the form of ADA just to make, additional money. It wasn't that I think that McDonald's did anything wrong. I actually think a civil engineer who designed their site would come back and say, my professional opinion is that there should not be customer and vehicular traffic crisscrossing.
Right. All right, another good question from Michael. How will TD Bank's in-store customer engagement change after COVID-19? Will there still be pens on tables being used for deposit slips? How will individual client meetings be managed in offices? Go for it.
I wish I could answer that question. So I'm not heck of a panelist. I can think, I can tell you that the behavior will change. I think I wouldn't be surprised if if the wearing a mask is something that becomes a permanent thing at a retail level. But again, those are very subjective, you know, comments on my part. I think you're going to see, like I said, available to a customer somewhere, a disinfectant for your hands, sanitizer in probably every retail store, not just banking, but any other retailer where customers, and I think you began to see that even before COVID-19, some retailers were already going down that route. I think it's going to be more on how we provide our services. I think you're going to see an emphasis on appointment banking. We launched something like that now as part in reaction to this, where we have, you know, a hotline and you can make an appointment out to do your banking. I think the idea of educating our customer to the other tools that are out there to do your banking, like smart ATMs and online banking, you're going to see a shift now. Instead of just marketing a product, I think you're going to begin to see an educational process of the customer and educating them about what's available, that you don't have to walk into a store to get what you want. But again, those are subjective things on my part, not anything that I can tell you TD is doing at this moment.
It strikes me as ironic that I'm guessing it's mostly seniors that are still wanting to come physically in to do banking, yet they're the ones the most at risk from COVID-19.
Exactly.
Right.
And along that line, you know, one of the things that we have done is actually put in place a priority phone service for seniors, so that they have priority on the phone lines to be able to call the bank and ask for assistance. The same thing way to our healthcare people. They are on a priority line to be able to access the services of the bank.
Okay, let's see. We got Kenneth asked, what kind of PPE are you asking your vendors to wear prior to entering your facilities?
We at Davita are asking them to wear masks, wear gloves, and wear coats. We are asking them to enter after the last patient has left and not during business hours. And we also instituted taking the temperature of anybody that walks into the clinic or prior to entering the clinic, just to confirm that it is safe that they're safe to walk in.
That's interesting, because in our panel a couple of weeks ago that was very retail oriented, mall-based retail oriented, it was brought up that there was discussion around taking people's temperature before they entered a store. Like, you know, could that be a norm that down the road for all of us?
It could be. I mean, I had somebody pitch that to me already, because all of our stores have LCD screens in them. And somebody came up with a software, actually the vendor that services our LCD screens in the stores, which today are used for marketing purposes. They already pitched a software that if you stand 3 foot in front of the sensor that they're going to put inside of the screen, you can tell the temperature. There'll be like a head scan of the person on the screen that will not only read out the temperature, but will show it in red and greens. That person, the question is, okay, now that you have that, what do you do? Say your temperature is 102, you can't come in. You know, there's so many other aspects of it that need to be thought out.
Fred,
Yes,
I'll
sir.
throw this one at you. What changes do you think in your world will end up being permanent?
I don't know. Good question. You know, the thing came up with our dining rooms is being permanently 50% capacity. And by this, you know, taking out dining room tables, taking out booths, what have you. that's a possibility. You know, it seems like a lot of work right now to do this, but if that comes up, for now, the plan that I have at least is using table tents to mark as certain tables and booths can't be used for social distancing reasons, instead of trying to store all that equipment and furniture. But I think there's going to be some sort of revision on occupancy across the board, whether it's restaurant, retail, banks, what have you, gyms, everything that we know of now. I think occupancies are gonna change.
Well, they primarily all were based on fire code probably, right?
Right, right.
So this is a whole interesting other input to deal with when you're coming up with those calculations.
Right.
I would ask the panel in general here. What advice do you have for your peers? You know, there's a bunch of your peers that have been sitting on either A, all the locations are closed and they're dealing with that dynamic, or B, they've been furloughed altogether and hope to be brought back very soon. What are they in for? What advice do you have for them right now? I'll go around to each panelist and then we'll start wrapping up. Todd, why don't you start with that?
Well, you have to follow the law that's out there, the requirements. There are things we probably all would disagree with, but the one thing the company can't have is get a black eye for not following procedures. And, you know, from our standpoint, making sure that they do follow procedures. It's, you know, I know we all want to get back to work. We all don't like this, but the reality is, you know, if we can open up facilities with, you know, preventative measures, and it's going to cost a little bit, but if we can open those up, then, you know, we can get back to an economy that's there. And I think that's what everybody wants out there. That, you know, and then the other thing is there's going to be a lot of changes in design and then in construction based off of building code, based off of fire code, based off of ASHRAE, that people are going to talk about over the coming years. And I would say one thing that, you know, as owner representatives and as contractors and anybody else that's out there, to engage with that, to, you know, make sure they don't go beyond something that may end up hurting your business, and voicing that. And, you know, this is a great time to get involved in IBC and ASHRAE and, you know, fire code and state specifics. And, you know, because we all want to do better.
Thanks, Todd. Fred, comments on that? How would you advise your peers kind of coming back into the fray?
Yeah, kind of echo what Todd said. You know, you got to follow the rules, stick within it, keep your employees and your customers safe. I would just recommend not jumping the gun. You know, try not to go ahead and start covering everything up that possibly can be covered. Start making modifications, because even these plexi panels that may or may not be permanent, they're all going to have regulations on size, distance, what have you. So just don't want to, you know, waste money, you know, prematurely here. So just be patient, try to follow those guidelines. Like Todd said, we're going to have new national, state, and local regulations coming out of this. So just got to keep track of that, follow it, adhere to it, and then react where you can immediately.
Thank you, Fred. Monica, closing thoughts, advice for your peers?
Yes, there are several collaboration with multiple channels. I think it's paramount quickly. Yes, we reacted and we ever changed the guidelines as they continue to evolve, as I think all of us have experienced. CDC, we followed definitely. Emotional well-being of the employees and patients and teammates has been also a very present of mind in our company, because not only the business has been affected, and thus emotional repercussions to that has come as well. And together we just really can make great things happen. And it's important to collaborate, communicate, and two heads think more than one. And that has been a really good experience for us.
All right, thanks, Monica. Andres, I'll give you the last word.
I think everybody basically said what I was going to say, so I like the fact that I have the last word. I mean, I would echo everything that Todd and Monica and Fred said. I think it's early. I think that municipalities, states, even at a federal level, regulations are going to come out. I would say if there was one takeaway is follow the guidelines that exist, the procedures, the safety is first, and really stay open-minded. I think we need to stay open-minded and listen to ideas and be flexible. I don't think approaching any of this with a rigid rule, I have the solution that's going to fix everything, is going to be a good behavior. You need to be flexible and listen to the people that we support, at least from my end as a service provider, which is what I say I am, even though I have an architecture degree, construction, project management, facilities. What we do is we provide a service to a customer. And I think we sometimes don't listen to that customer as well as we should. So collaborate, listen, communicate, and be flexible would be my recommendation.
All right, what a perfect way to end. So I do want to thank this panel. First of all, thank you for being part of what's left of our economy. And thank you for providing the services that we obviously need are essential. I'm glad I can still go to my bank. I'm glad I can still get groceries. I'm glad I could still pick up a bagel. And I'm glad that there's healthcare available when I need it. And so thank all of you for that. Thank you for joining this panel, being willing to give your time. We are really grateful to have had you. It's a rock star panel. Thank you so much. And thank you all of you that took the time today to listen in. Really appreciate it. If you have any feedback or thoughts for us, you'll get a survey as soon as we click off. Please do give us that input. And we'll be holding another event soon in a couple of weeks. Thanks, everybody, and have a great rest of your day and rest of your week. Signing off.
Thank you, Steve.
Thank
Take
you.
care.
Thanks, Steve. Bye.